Hey everybody, it's Emily. Today is the 2nd of March. I'm a little behind on my update. I had a little problem with the internet connection and a few other little mishaps. So this update is for February, I believe it's February 27th. I went Thursday to see my primary doctor. As I've told you guys before, I have an unfortunate 6-month medically supervised diet weigh-in with my doctor due to my insurance. It needs it for before my surgery. Anyways, I did a real healthy grocery haul. I thought I was doing great. I was doubling up on my water. I cut out soda. I cut out juices. I cut out Kool-Aids. I cut out all sweet drinks other than a cup of coffee at church. All I was drinking is water. I added tons of vegetables into my diet, was eating salads for breakfast, all kinds of crazy things. So I was amped up to go into my doctor's office and weigh in. I proudly went up there onto the scale and I was like, yeah, I'm going to lose some weight, even if it's a pound. Well, unfortunately, I didn't lose any. I didn't gain any, but I didn't lose any. And from then on, I just kind of walked with my head down. I was pretty upset. I was confused a little bit because I didn't see how, with drinking the water, cutting the sugary drinks out, cutting a lot of calories out and adding a lot of vegetables, and how can I not lose? Not even 1 pound. How can I not lose? I don't know. I don't get it. Anyways, so 1 month down. So I have 5 more months till my surgery. And I put the little quotes there because I'm sure there are other things that I need to get done till the actual surgery date. Anyways, I'm saying 6. I just have 6 months of the medically supervised diet. So I'm 1 month down. Anyways, what else I wanted to do on this update was I got this lovely little folder. I don't know if you can see that, but it's Via Christi Health. That is where my surgery will be done. I have a bariatric surgery checklist that they gave us at the orientation, or whatever you want to call it. The orientation. Sorry, I'm a little scatterbrained because all I can think about is why I didn't lose. Anyways, my bariatric surgery checklist looks like this. I know it won't be very legible, but look how long this checklist is. I have to have all of these done and checked off before my surgery. And I will read and go over some of them. It starts with some of the people that will be working with me. The nurse practitioner, her name is Kate Jantz. Hi, Kate. The health educator, her name is Shelly Ewerts. Hi. Basically, both of them were at the orientation. They were nice ladies. I will say this. They were nice and skinny ladies. So it was like a shock, to myself and I'm sure to others, because at the orientation, I'm looking around and looking at myself and like, wow, we are very overweight and they are super skinny. They turn and we lose them. We gotta find them. Anyways, but all I could do was think the whole time was, if I can even look half as good as they do when all this surgery and things are done, I'll be happy. So, but like I said again, no offense. They're very, very nice girls. They will also be working with some classes that I'll tell you about in a little bit. Helen Ramsey is a dietitian. I have not met her yet, but I look forward to meeting her. The surgical specialists, there are, looks like 3 of them. Dr. Lancaster, Dr. House, I believe is how it's pronounced, and Dr. Brown. I meet with things in a week. I meet with Dr. Lancaster, which will be my surgeon. I would like to say hi to you too, if any of them are watching, which I doubt, but hey. Anyways, the health educator, Dina Martin, I have not met her either. There are several different psychologists, which apparently, okay, before you can have this surgery, you have to see a psychologist. That one kind of, I wouldn't say frightened, but kind of, I don't want to see a psychiatrist. I'm 27 years old. I've never seen a psychiatrist. I'm not crazy. I don't need a psychiatrist. I've been through a lot in my life, but I have been able to work it all out myself. I don't need a psychiatrist, so this will be interesting, and I'll let you guys know how it goes, because I just don't want to see one, but I have to. Anyways, apparently, I've been told it is good to have the psychiatrist on your side, because your body, not only your body, but your mind and everything goes through a big change during this surgery and during the process of losing the weight. You don't want to lose yourself of who you are, who you were, and wake up one morning and be like, who am I? So that's definitely a good point, because I definitely want to stay my true self. I don't want to wake up one morning and be some snotty-nosed, too good, That's not me, never have been. I've been through a lot, and that's what makes me me. I've always taken care of people, always cared about people, and that's who I am, and I want to stay that way. Anyways, the next one, is, okay, so the checklist now, PCP authorization. So the PCP, because I was like, what the heck is PCP stand for? Anyways, I know, I'm blonde, but I'm sure there's other people that don't know what, that stands for. Primary care physician. And I got her to authorize the paper. That was a bit of a tongue twister, and that should have been in a gag reel, but I'll leave it on there. Anyways, so I got that one checked off. The next one is I will have to meet with the nutrition, and get that one checked off. Not sure if the nutrition is talking about what I will be eating or what I eat now, but anyways, it'll be good for me, and it'll get up the checklist off. The psychiatric evaluation, that one I'll have to get checked off also. Like I said, I'm not looking forward to that one. The next one, sleep study. There's a sleep study or overnight pulse oximetry test on room air. So some of us, and actually it's quite a big number when you are overweight, you have more weight here. You have a harder time breathing because you have more weight on your chest and around your lungs. Anyways, so when you sleep, what I was told is, all your muscles get relaxed. They just, they give up, including the muscle in your throat and your tongue and everything like that. So when you sleep, your tongue kind of goes back, and then it causes like the snoring some people have and all that things. But sometimes it closes that airway, and then it causes what it's called sleep apnea. So when you have a sleep apnea problem, surgery is not the best option. So you need to get that checked out. You need to make sure you don't have sleep apnea. If you do have it, they can treat it. They'll give you a CPAP machine, which you put on your mouth, like, makes you sound like Darth Vader. But it will help you, and you definitely would like to have that if you need it. I'm hoping I won't need it. I went and actually saw a sleep study doctor on Friday, I think it was the 27th or 28th of February. So that's looking good. I'll have to do the pulse oximetry test. I have to put the thing on your finger while you sleep, and it measures the oxygen. Anyways, I'll try to hurry up on this. Some insurances require you to get a cardiac clearance, which mine includes that. An EKG, you have to get an EKG, so I'm a little nervous on that. Let's see. Lab. You'll have to have lab taken, and they check the CBC, CMP, lipid panel, TSH, HGB, H. pylori, vitamin D, PTH. And I have not a clue what most of those are, so might have to look those up right there, down there on Google or YouTube or something like that. But I did went and I got that done about 3 weeks ago, and all mine were normal, and including my cholesterol, my thyroid, all those absolutely normal and healthy also. Which is the crazy thing is, always, being the bigger girl, I've always been a healthy girl, and it's just crazy. And I don't know if it has something to do with, I've always, try to get, my fluids in, eat semi-healthy, other than like scarfing down all the bad foods too. But anyways, I've super lucky, and I thank God for that. Anyways, then later on, you will have to recheck your vitamin D, I think before or after this surgery, to make sure that that's still okay. So then the next one on mine, and it's not on everybody's, but it's 6 months medically supervised weight loss. And like I said, I have 5 months to go. Anyways, the next one is receive the orientation packet, which I am reading to you, and I have. Attend the orientation, which I have. I did that about a month and a half ago. The next one is attended lifestyle classes and attend pre-op classes, which is crazy because they are 8 consecutive weeks of classes, and you have to pay for them and be there, and the classes to me are about an hour away, and I have 3 young children, so that's going to be a difficult one to attend. I don't know what these are. Written pre-test, written post-test. I don't know what those are, but they're on my checklist, so I'll have to look at that and find out what they are. So here is my patient's pathway to surgery. And you can see on there are several different ways. and it's basically kind of introducing and explaining the things that I just read off to you, but in a different way. It tells you, like, so you do these, and you get a call from this lady that sets up your physical exam with your surgeon, which I do that, I think it's Monday. So that is great. I'm so excited to see him, meet him, and find out, what the best plan is. So yeah, and the one past 5 is surgery. So definitely I'm excited, and I would love for you guys to follow with me during, my pre-op updates and everything like that. And I will be saying goodbye to you because I don't want this video too long. But it was really nice checking in with you guys. If you guys have any questions, any info for me, any just little hints, tricks, tips, anything that you can think of to just throw at me, just comment below here, down here, comment. It's not that hard. Just take a minute out of your day. You can also go right down there and subscribe to me. It's free, no cost, no charge, and you can watch me every week or every 2 weeks, however you want to do it, and we will keep in touch because I know I need you and you need me. So anyways, thanks, and we'll see you next week.